Good evening, everyone. My name is Jonathan. My name is Jonathan Bayaku. I am the education.
Your name is Jonathan. Hello.
Yes, sir.
Your name is.
Hello. Jonathan Bayaku.
Okay. So yeah, go ahead. I'm listening.
So you're almost welcome to today's session. We are most grateful to our speakers for joining us this evening. So this is part of the Incision Ghana project for the education team, where we bring surgeons and residents from the various specialties for our education. So we try to bring these surgeons together so that they can enlighten the medical students and the young doctors about the field of their specialty, so as to encourage people to pursue their specialty. So this evening, the purpose is to understand the practice of neurosurgery in Ghana, then also encourage our younger to go into the field of neurosurgery. So we are most grateful to our speakers for taking time off their busy schedule to join us this evening. You are most welcome. So I'll hand over to Dr. Togas, the chair for Incision Ghana, to briefly introduce to us what Incision is, then we'll proceed from there.
Thank you very much. I'm very, very grateful for the time you set aside for us to be able to have this meeting today. So Incision basically stands for International Student Surgical Network. So Incision Ghana is just one of the national working groups of Incision Global. I'm Dr. Saki. I'm a member of the Ghana College of Surgeons. I'm the chair of Incision Ghana.
Okay.
So Incision was born after the introduction of the concept of global surgery, when Mira et al. Published the Lancet Commission on Global Surgery. And since then, there has been ongoing ways to be able to, for us to advocate for the practice of global surgery all over the world. So we usually, as Incision, we act in three main arms: advocacy, education, and research. So we advocate for the activities of global surgery, such as the safe, affordable, and timely surgical care to everyone, irrespective of the person's geographical location. So if I say surgery, it also includes the practice of obstetrics and gynecology and also. Since the introduction of global surgery, there have been various groups that have come up, including the G4 Alliance and Aranja Labs. We also have the World Federation of Surgery in South Africa. Livebots also do some activities. But Incision actually was started by some medical students from around the world, Dominic Vergot being the main co-founder, and was started in 2018. Since then, there have been celebration of some of the important things that actually mark the Incision activities. So we also go do some activities around research. Currently, we are undertaking a research mentorship program where some of our mentees have been able to actually write a full manuscript with some successfully submitted for publication. And we believe in collaborative research activities. So these are some of the research work that has been done with our global team. Hello, can you hear me? Hello, Dr. Gisu.
Yes, please.
I can't hear you.
Go ahead.
Yes. I don't know if I'm the only one who's not hearing.
A bit louder. What? Go ahead. I'm hearing you.
Okay. All right. So we also do some education activities.
Okay.
And that's one of what we are doing now is one of the education activities,
Beautiful.
educating our members on the importance of it. So I'll hand over to our education team to continue.
Okay. So, is that Dr.
Daba, I think you can take over.
Yeah. Okay. So my name is Dr. Java. I'm the co-chair for Incision Ghana. And once again, we are very glad for spending this evening with us. I think Jonathan is the education lead. He's having issues with his network. So, Jonathan, if you are back, you can take over. If not, I'll go ahead and then introduce our speakers. Okay. Hello, Jonathan.
Yes, I'm back.
Okay. You can take over.
All right. So our first speaker for today is Dr. Mutakawakilu Idrisu. He is currently practicing at Kolebu Teaching Hospital. He's a consultant and a senior lecturer at the University of Ghana Medical School. Dr. Idrisu had his medicine, he obtained his Doctor of Medicine degree in Germany in 1979. Then he went into residency in between 1979 to 1978. 78 to
Meeting.
Daba, can you take over?
Okay, so let me continue. Dr. Idrisu, from 1979 to 1984, had his neurosurgical training in Germany, and then he started working in 1985 at the Department of Neurosurgery, Department of Surgery at Kolebu Teaching Hospital, and he has been working there till date. In 1993, he became a fellow of the West African College of Surgeons, and then from 1994, he became a lecturer and is currently a senior lecturer at the School of Medicine at the University of Ghana. He has been an examiner with the West African College of Surgeons for the Part 2 examination of neurosurgical candidates, and then also fellowship assessments and dissertations of neurosurgery candidates since 2000. He's an examiner for registration of specialist doctors with the Ghana Medical and Dental Council. He has been a board chairman of Tamale Teaching Hospital since 2009 to 2015. He's a board chairman of Sky Consults Limited and Utah Energy Limited. He has attended several scientific conferences, both local and international, and has over 27 peer-reviewed scientific articles. He speaks many languages: English, German, Hausa, Dagbani, Twi, and Ga. He plays tennis and swims as well. So he will be Dr. Idrisu is one of our speakers for tonight. So I don't know if Dr. Idrisu can give us a hi.
Hi.
Dr. Idrisu can say hi.
No, this is around.
All right. You're welcome, sir.
I can see faces here. I can see Dr. Totimi here.
Yes. So
Yes.
Dr. Totimi is the next person I'm going to introduce. So Dr. Totimi trained at University of Ghana Medical School for his MBCHB and completed his neurosurgical training at Kolebu Teaching Hospital under the West Africa College of Surgeons, and then subspecialized in pediatric neurosurgery at Liverpool in the United Kingdom. He's active in neurosurgical advocacy and leadership across the continent, and he holds several several positions, including the executive committee member of the International Society of Pediatric Neurosurgery and the Society of Neuro-Oncology Sub-Saharan Africa. He currently runs a private neurosurgery practice at Luca Health Medical Specialty, I beg your pardon, in Accra. He loves music, swimming, and then Scrabble. So if Dr. Tetima is here, he can also say hi to us. All right, thank you very much.
Thanks for having me.
Yeah. So our next speaker is Dr. Dixon Kwajobando. He's an early career neurosurgeon with clinical interest in brain and spine trauma and then degenerative spine diseases. He has almost a decade of clinical experience as a surgeon, with the last 2 years as a neurosurgery at a neurosurgery unit in 2 major hospitals in Ghana. That's the Confanochi Teaching Hospital in Kumasi and then at the Tamale Teaching Hospital in Tamale. He's active in clinical and academic training of neurosurgery residents in both teaching hospitals that he has worked. He has over a decade of experience in medical education through his work as a part-time lecturer with the School of Medicine, UDS Tamale, and also at the Medical Stimulation Skills Institute. And more recently, he has become an e-tutor in the MSc Surgical Sciences program at the University of Edinburgh, UK, and also a program mentor with MSc Medical Leadership Program from Center for Training and Development, Lancaster University in the United Kingdom. He has also co-authored publications in neurosurgery related topics and is currently a co-investigator in an ongoing spine trauma registry at Confanochi Teaching Hospital. He previously served on Governing Council of the Ghana College of Physicians and Surgeons as a representative of residents in training and currently chairs the board of the Ghana Medical Association of Pensions, Ghana Medical Association's Pension Fund. He's an active volunteer in community and previously worked as a volunteer doctor in the Tamale Central Prison and as a volunteer surgeon in the Shekina Clinic for the Poor in Tamale. He is a fellow of the West African College of Surgeons Neurosurgery Division, where he was awarded the Olisa John Olutola Olatosi Prize in Neurosurgery. I think he will explain what that is to us. And then he has a postgraduate diploma in spine surgery from the AO Spine College, where he was adjudged one of the top 3 graduating surgeons for his cohort. He's a member of the American College of Surgeons. He is an American College of Surgeons certified provider of advanced trauma life support, and he holds an MSc in Surgical Sciences from the University of Edinburgh, and also an MSc in Medical Leadership from the CTAD, UK, among other host of postgraduate qualifications. So if Dr. Bando is here, he can say hi to our audience.
Hi everyone. And let me take the chance to say I'm humbled to be on the same platform with a giant of neurosurgery in the person of Dr. Idrisu, and to my senior brother in neurosurgery, Totibe, whose steps I'm keenly following as he moves along. So thanks for having me this evening.
Welcome. We're lucky to have you here, Dr. Bando. I'll go on and introduce our last speaker, who is a trailblazer in her own right, Dr. Jennifer Berrick. She completed her medical training at the Belgrade State University in Russia and worked as a house officer and medical officer at Tamale Teaching Hospital. She's currently a neurosurgery resident at Rage Hospital in Accra and has interest in pediatric neurosurgery. If Dr. Berrick is here, she can say hi to the audience. And then
yeah, good evening and thank you for having me. Yeah, it's such an honor to be among such a great panel. Thank you.
Thank you very much, Dr. Berrick. We are happy to have all of you here. So I think we move on straight to my favorite part of the discussion. So the purpose of this meeting is just to have a discussion with our senior colleagues for them to inspire us and then guide us in our careers, especially those of us who are interested in pursuing neurosurgery. So we have a list of questions here, which are basically just guide to help us have a fruitful discussion with you guys. So I'll go ahead and start with my very first question. So the very first question, of course, will be why neurosurgery? I mean, there are a lot of fields in medicine and even in surgery. There are various fields in surgery. So why neurosurgery? What pushed each of you to pursue this very demanding, or at least that's what we think? I'll start with Dr. Berrick, and then I'll move on to Dr. Bando, Dr. Time, and then Dr. Idrisu. So,
Okay. Hello, can you hear me?
Yes.
yes, please.
Yes. So to answer your question, for me, I think I got into neurosurgery by accident, so to say. I didn't really have an idea about neurosurgery until I started my house job. Obviously, I'd heard about it dealing with the brain and the spine, but I was never exposed to the details and what really went into being involved with neurosurgery until I did my rotation, my surgery rotation at the Tamale Teaching Hospital at the neurosurgery unit. Actually, before that, I was exposed to ONG, so I was 100% sure that I would do ONG until I went to the neurosurgical unit. And I saw a variety of patients and cases, and it was different in a way. In ONG, you go, you do your C-section or your gynae issues, and the patient is fine. But there was this particular case where the patient came with a GCS of 4 and epidural hematoma at the time. And thankfully, we were able to do the surgery. And funny enough, about 24 hours post-op, GCS was 15 on 15. So I was really, really amazed. I had never seen something like that. So that was where my interest started, and I decided to follow through with it. Yeah. Thank you.
Wow. It was more of the exposure to neurosurgery. Dr. Bando.
Well, I was actually hoping you'll start from the very top. So I could have drawn some inspiration from, the words of Dr. Idrisu and Dr. Totime. But for me, the question is, why not? I have always wanted to be a neurosurgeon. Even before I went to secondary school, I knew I was going to be a neurosurgeon. And I think it has something to do with the brain and spine. And the fact that unlike the other, surgical disciplines, in neurosurgery, what you see is what you get. It is very hard to feign a symptom in neurosurgery, unlike, say, abdominal surgery and so on. Neurosurgery it's beautiful. For me, it's beautiful. The fact that somebody has a pathology in the brain, has a pathology in the spine, with an intervention, you can literally, bring the person from, just as Berrick indicated, near death, back to life. With intervention, someone who couldn't walk, you are performing a miracle and the person is walking. So for me, there lies the beauty of neurosurgery. The fact that so complex and delicate an organ, which has both physical and metaphysical properties, if you know what I mean, you are given the rare privilege to work with it and then restore lives. For me, that is the attraction. And that has always been the attraction about the neurosurgery program.
Dr. Totime.
Yes, I got into neurosurgery because I was basically a patient. So when I was in Form 1 of high school, I collapsed in class. And at the time, You know, in Ghana, there were no real neurologists. There were not too many neurologists, and it was thought that I had had a seizure. So I was sent to a neurosurgeon, and over the next year, I would be seeing him on and off every 2 or 3 months, until finally I was cleared, and just, you know, allowed to go back to school and stuff like that. But during this year where I was seeing him on and off and doing different tests and things like that, we developed a relationship. And I think I was just so impressed by this doctor. Actually, he happens to be Dr. Polampo. He died this year. I think he must have made such a significant impression on me that from then on, all I wanted to do was neurosurgery. So basically, when I was entering medical school, I knew it was a stepping stone to neurosurgery. There was a time during medical school when it seemed like I would be more interested in other things. And actually, by the end of house job, I was very, very interested in pediatrics, because in the children's block, I had really seen the impact of pediatricians on these kids. But during my residency in general surgery, I did a rotation in neurosurgery, and this sort of rekindled my first love. And from then, I didn't turn back. I still had children on my heart, so I was really privileged and thankful that I was able to do a fellowship in pediatric neurosurgery. And yes, so that is my story with neurosurgery.
Wow, very inspiring. Dr. Idrisu.
My particular case, my father even didn't want me to become a doctor. He felt that, very interestingly, he had a small land in front of the home. And
Doc, please, we can't hear you.
Edison, are you hearing me?
Yes, we can hear you now.
Saying that to begin with, my father didn't want me to become a doctor to begin with. He wanted me to become a lawyer. We had a small plot of land in front of our house in Yendi, and he was always litigating with them. So he wanted me to become a lawyer. But unfortunately, I turned out to be a medical student in Germany. I went to Germany on a German government scholarship. Right from the beginning, it's just like how it's not all that straightforward for many doctors to choose neurosurgeons as their specialization. In my particular case, it was a straightforward thing. I'd happened to know a very good professor in the Department of Anatomy in my university in Germany, in Halle, University, Martin Luther University in Halle, a very wonderful professor who was very good in neuroanatomy. And he taught me neuroanatomy. He made neuroanatomy so simple. So I got fascinated. My first time of seeing him open the cranium, I saw the brain, and right from the beginning, got so fascinated. Now, in Germany at that time, our class were not more than 60 students. It was a small class, and all the opportunities were available. During the period of anatomy classes, after lectures, you could go to the anatomy lab, you could go into the department and do dissection. And they were all the time assistants and all the trainers, lecturers, with residents also involved, helping us to do dissection. And neuroanatomy was the only thing that fascinated me. I loved looking at the brain at that time. And that is how I developed interest for this particular area of the human body. And this is what happened. My professor, called Professor Sharp, liked me very much. So I used to go to anatomy lab, even when we didn't have lectures. Sometimes even weekend, I used to go there. And he was constantly in the lab, doing a lot of research work. He did a very hard-working professor, research work. Almost every day he was there doing some research work. And he liked me. He one day asked me what I wanted to do at the end of my medical studies. I told him that I'd come to Ghana on a vacation and I saw a neurosurgeon, Dr. Mustafa. And he was seen in Ghana, he was considered a superstar in medicine, a superstar in surgery. And that really impressed me. I had an opportunity of coming back 3 years after that, or 2 years, 4 years after that. And I went into the theater to watch him operate. Frankly speaking, as I was a student, Professor Sharp was able to make it possible for me to visit theaters. And my interest was just in the neurosurgery. I love seeing, and we used to stand behind a glass window and look inside the theater and saw how surgery was performed on the cranium. And the first time I came to Ghana and entered the theater to see Mustafa operating as a student, I was not all that fascinated, frankly speaking, because I didn't see the type of practice that I saw when I was in Germany. And this, as a matter of fact, inspired me because I thought I should. The neurosurgery practice at that time was not, it was not enough. That is the standard. I wouldn't blame Mustafa at that time because he was practicing under very difficult conditions at that time. These are some of the challenges that he had, and he had challenges, of course. And that's why when I went back, I thought, well, I should put more interest in it. I should work harder. And I explained this to my professor. And he continued inspiring me that I should continue with the profession. And this is how I went into the profession. And almost every 3 years, I came to Ghana. Almost all the time, got in touch with Dr. Musawash. And he also encouraged me that I should do neurosurgery. This is how I became a neurosurgeon.
Wow. Thank you very much, Dr. Idrisu. I think you mentioned something about the conditions when you were just starting out. I want to draw on your experience a little bit. How has the trajectory of neurosurgical training or practice been from that time up until now? How has it evolved?
It has quite, but there were so many challenges. When I came back to practice, the system, when I came back to practice, I had Dr. Mustafa, who was then the only neurosurgeon in this country. I saw him operate. There was one particular case I came in when I returned to join him in the theater. He had a case and was supposed to be a chronic surgery. I saw him do a bare hole craniostom. And what he showed me at that time, which was supposed to be a chronic subdural hematoma, did not turn out to be a real chronic subdural hematoma. I noticed that he had equipments which were actually not the ideal equipments that one should have used to do this sort of surgery. Fortunately for me, when I came, I brought along my own Hudson
The
brace.
DSTV. So how are you going to
Hello?
Then
Are you getting me? Are you getting me?
Yes, we can hear you. It was just a speaker that was, but we can hear you.
What was your question again?
I wanted to know how neurosurgical practice has evolved over the years.
Yeah, that's what I'm trying to go about it. That when we started, we're doing general surgical practice. In other words, a lot of neurotrauma was done from the beginning. Most of the neurotrauma were, before I came, were done by Dr. Mustafa. And some of the general surgeons also did some neurosurgery. Pediatric surgery was done by the Dr. Tando. He was doing pediatric surgery, and he manages the basic congenital malformations like spina bifida and then hydrocephalus. That's how it started. But when it's just gone off. That's gone off. Oh.
We can hear you, sir.
Put it on.
Sir, we can hear you.
You can hear me?
Yes, sir, we can hear you.
Yeah, we can hear you.
Yeah.
We can hear you.
Yeah. I'm telling you the way I started and how I brought it up to this stage. At the early stages, I was with Mustafa, and I did very little in Kolebu. We had also 37, where we could go and do neurosurgery. So at that time, I was running between Kolebu and 37. Around this time, Dr. Populampo came down to join to join Kolebu. He was there for a very short period of time and went back to 37. So I was between 37 and Kolebu. The cases that mostly were done at that time were mostly trauma cases, where most of the trauma cases we had at that time were the head injuries. That is, the trauma, the spine injuries were there also, but we did very little spine trauma. Most of the cases were head injuries. Brain injury, what you call surgery. I was the first person to start serious brain surgery in Kolebu because I had the equipment, Hudson brace, I had the giggly saw, I had the perforators, I had everything. In fact, I had a complete set. And this is what I was using at that time. We didn't have a craniotomy, we didn't have what do you call it, Escalop, we didn't have a Madarex, we didn't have all those things. But we had this basic neurosurgical equipment. And most of the cases were done in Kolebu. I did some cases also at the military hospital at that time. The spine surgery, what I was doing at that time when it came to spine was just a decompression, either anterior or posterior. The posterior decompression were purely the laminectomies. We didn't do instrumentations. Now, what also I did anteriorly, I did just decompression anteriorly between levels, remove the disc. I put in grafts, but I didn't put any instrumentation at that time. It so happened that my trip to the US, I met one gentleman called Dr. Rawlings, and who introduced me to instrumentation. He gave us some instruments. I brought them to Ghana. And he came to Ghana and started instrumentation. We started with anterior spinal interbody fusion with plating. He brought me a lot of equipment. I started with young colleagues. I was the only one who was doing these procedures until Dr. Dakura joined me as a junior resident. Then later on, Dr. Weber also joined us. We didn't have any residency program at that time. But then we got Finks Fellowship, and they were helping us with some equipment. That's how we started. At a point, I was alone running the neurosurgery. I was operating with nurses to begin with. And when these residents joined me, Dr. Takura joined, was the first to join. We started working together. And it was a gradual process until the point that I met Oyinbo Bwachi in the US, who also came and then joined to improve surgery in the spine. In fact, today we have a spine program going on in the office at his place. And Dr. The gentleman who just spoke, what's his name, Dr. Is one of the Dr. Oh, what's his name? He was one of those who joined us. He's now one of the spine surgeons. We have a program today, 2 years program with the spine surgeon. There had been a lot of difficulties throughout the whole period of time. During the period of the study in medical school, I had an opportunity to attend a lot of courses where we had to solicit for so many equipments. And then this is how it's all going on.
Wow, thank you very much. That's a very I would say a wild journey. Yeah.
It was a wild journey. It was a wild journey.
Yeah. Yeah, glad that you're here to share that with us. Thank you very much. I'll move on to the next questions, and I would like Dr. Tatime and Dr. Bando to help us. So I want to know what sets neurosurgery apart from other specialties. I mean, any of you can go first.
Oh, okay. Should you want me to go into that one? I should go into that one. Hello?
Yes, boss, you can go ahead.
I can go ahead. Well, if you look at the neuroanatomy, the brain, as a matter of fact, appears to be the master organ of the body.
Mm-hmm.
And neurosurgery handles all. What's happening? Are you hearing me? Are you hearing me?
Yes, boss, we are hearing you. Dr. Idris, we can hear you. Hello?
Okay. What I want to say, the brain is considered as master organ in the human body. The Hippocrates considered the brain as the only organ more important than any other organ in the body. So that if we are handling neurosurgery, if we are handling the brain, you handling the brain being the muscle of, or the what do you call it, the most important organ of the body. Very distinctive. In the medical practice, neurosurgery is so distinctive, and it's so distinctive, and then.
Hello, Dr. Idris.
His internet is not stable. So
Okay, I think we will move to the next question.
Hello. Can you go ahead?
Yes, boss, we can hear you. Hello. Okay. I think yeah. Okay, so Dr. Bando, I mean, if you can, we want to know. Hello.
Yes, we can hear you.
Sorry, it has come back. I have some technical problem here. I have some technical problem here. I wanted to say that the brain is considered a master organ in the human body. Some people consider the heart as the organ that feels pain and anxiety, but that is not the case. However, it is the brain only that arises fear, emotions, pleasure, pain, beautiful and ugly things, good, other. You see, we think that the brain is an interpreter of consciousness, right? One consider that the soul is located in the heart, but because of the peculiarity of the brain and its study, neurosurgery is a distinctive area in medical practice. Despite the disciplines of neurosurgery, the medical practice, this special discipline has forced neurosurgeons to be ultra modest in their lives. So one sees that neurosurgery stands out differently from other specialties because it handles the brain, and the brain is the center of almost everything. That's why I see that neurosurgery stands completely apart, though the other specialties are also very important. Go ahead.
Thank you very much, Dr. I'd like to move on to the Dr. Bando. It seems I'm very keen on asking you a question. So I wonder if you tell us what you think is the biggest misconception about neurosurgery.
Well, I think it has to do with the outcomes. You know, when you ask people, do you want to do neurosurgery? It's like a reflex response. No, why don't you do it? The outcomes are not good. You know, and I really, really struggle to understand where this misconception is coming from and what they mean by outcomes. But like I keep on saying, you know, neurosurgery is a discipline that is time-bound. Just like the brain and spine being neural structures, time is of the essence. So the reason why there may be that misconception about the outcomes may be because of the time-related delays that patients, you know, requiring treatment experience. But for me, even with the time delays they get, once they get the interventions, the outcomes are pretty much exciting. And I always go back to Beric's example she gave about the chap with the epidural hematoma. I've literally had that death waking up experience with one of the patients who this time around came with chronic subdural hematoma, GCS of of 3 or 4, I can't remember which one. The reason why that case still sticks in my mind is that we did it in the emergency room. We didn't even go up to theater with this patient. And the chap just woke up and was asking where he was, literally right after the procedure. So probably because some of the procedures don't get done in a timely fashion, that is why there may be a misconception that the outcomes may not be too good. But with the advent of modern, neurosurgical practice that has been ushered in from the times of Dr. Idris who are following, I think that misconception needs to be dropped. People need to understand that, neurosurgery pre, 1980s or wherever, it's not the same kind of neurosurgical practice we have now. And the outcomes are much, much better than we are being given credit for.
Thank you very much. So if I understand you,
are you talking about the misconception we are talking about? Hello?
Yeah, yes, Prof. So he was asking about some of the misconceptions people have about our practice.
Well, what I want to say here is there's a really serious a big misconception here, because people think that we only operate the brain. That's not what they think. They think we only operate the brain. They don't know that we also handle the spine. That's the reason why people suffer back pains or pain radiating to their legs. They don't go to neurosurgeon. They go to doctors who went to do some courses. Today you can fix the spine, not necessarily being a surgeon. You can fix the spine, not necessarily. You can go for a course, instrumentation course, and you'll be able to fix the spine. So you don't need to go to a neurosurgeon. That is a misconception because of the complication that we are encountering recently, especially the high rate of pale back surgical syndromes that we are encountering a lot. It's a wrong thing to think that neurosurgery is only the brain, only operate the brain. No, we operate the brain, we operate the spine, and we also operate the nerves, the nervous system. So it's a wrong conception. And also, people think that neurosurgery can only be assessed in the big cities. No. We have young neurosurgeons who are so good, like those who have recently seen, who are in other cities. Kumasi, Cape Coast, what do you call it? Hamali, and other small centers. We can also assess neurosurgical practice over there. So it shouldn't seem that neurosurgery can only be practiced in the big cities. No, you can get neurosurgery, what do you call it, procedures done in other centers. That's one of the serious misconceptions that is going on in this country. Okay, go ahead.
Thank you very much, boss. I'd like to ask Dr. Berwick. Neurosurgery is considered a male-dominated area. And so I want to know what your experience has been as a female neurosurgery resident. But I think before that, I'm being made aware that we have the first female neurosurgeon in Ghana on the call. And I think we are very privileged to have such a person with us, Dr. Mabel Banson. So I think it would be good to draw from her experience as well. So after Dr. Berwick gives a submission, Dr. Banson can also chip in. Dr. Berwick.
Yes. Can you hear me?
Yes, please, we can hear you.
Okay. Well, I mean, our program started not so long ago. We are not even up to a year in training as the with the straight program of the neurosurgery residency. As a female, obviously, we all understand that in Ghana, we have currently about 28 neurosurgeons, and from that number, we have about 2 females. So, I mean, there's a bit of an imbalance. However, like you mentioned, Dr. Mabel is on the call. She has been one of my mentors, and I've been in contact with her, learning from her experience and just having her to guide us in this program. So far, I haven't really experienced, in terms of my male counterparts and me, I haven't really experienced any kind of, so to say, sexism or anything. My mentors, my supervisors, they treat us equally, and they try as much as possible to understand our struggles and see how they can help us navigate through them. So, I mean, it's an honor to be in this program, and I'm doing this program specifically to show other young girls that it's doable. It takes a lot of hard work, and it's long. There's a lot. It's Saturday and I'm on duty. As you can see, I'm in scrubs. So I'll be in the hospital over the weekend for 48 hours, but it's also rewarding as well. So I hope that encourages them to take the leap. It's challenging, but you can do it. Yeah.
Thank you very much. Dr. Mabel, if you're on the call, we would like to hear from you.
Hi, good evening.
Good evening.
Please, can you hear me?
Yes, we can hear you.
Kindly clarify the question for me.
I want to know how your experience has been as a female in a male-dominated area.
Oh, okay. Well, I always say that I come from a great country, you know. Here is a place where we have our senior colleagues who really don't discriminate among gender like that. So yes, there is some sort of female thing that we hear about, but that experience, I'd say I'm yet to experience it. We have one or two jokes where we ourselves kind of go around, okay, this is a hard job, try and do it, let's see. And all we say, I respond by, oh, you need dexterity to actually finish the job, not strength, you see. So we kind of joke about these things around. But talk of actual gender stigma and that, I'm yet to see one. Sorry. In terms of where we find ourselves, I would like to say a big thank you to our senior colleagues for what they do. And they actually go, we have Dr. Fatima and Dr. Idrisu on the call, and these are the two giants that actually go their way to promote female involvement. Thank you again for this.
Well, thank you very much for that. So I think our time is fast spent. We were planning on doing this in an hour, but I don't even have with us. We may have to rush through the rest of our questions. So I think a very important question to ask next will be how the specialty affects your lifestyle. You know, I think we've heard on this call that it's a very special, it's a very demanding specialty. So I would like to know from Dr. Tatime how your typical day looks like and how your field affects your day-to-day activities.
Well, so my typical day has evolved over the years. I was in government sector working. I actually left University of Ghana Medical Center as a consultant last year. And since then, I've been in private practice. My main hospital for operating is Accra Medical Center. And then I'm medical director in Luca Health Medical Center, which is an ambulant clinic. And then I also cover neurosurgery at St. Michael's Specialist Hospital. So my typical day would depend on whether I'm doing clinics or not. So I do clinics 3 times a week, once in Accra Medical Center and then twice in Luca Health Medical Center. Now, if I have surgeries to do, then it just depends on where I can put the surgery so that, I can do something else during the day. So if they're planned surgeries, these are elective surgeries, then sometimes we would start our surgeries at 5 a.m. And then so that by maybe 10, 11, we've finished, and one can go on with the rest of the day filled with other consults, covering emergencies and stuff like that. If there are emergencies, then we just have to do them as they come in. I also am a senior lecturer and head of anatomy at Accra College of Medicine. And so I combine, some academic work, with all this. So finding time to teach neuroanatomy to students and also coordinating some administrative duties for the Department of Anatomy. So I would say that it's a very interesting mix, and we just have to, balance things out and make sure that we are finding time for ourselves and also finding time for the job. This job can be a very hard master or mistress, but it does have its amazing rewards. The victories can be, really life-changing, but then there are also the defeats, and the defeats can be really breaking. They can really, take away your will to keep going. But then behind every defeat, there's always one victory, waiting. And it's one of the things that sort of keep us going. And, Ghana is a place where neurosurgeons can make a lot of impact because we're so few. And so it's a place where you can see the impact that you make. And you know that, if you were not around, the likelihood that something could have been done for that person is small, just because, your other colleagues are also really, swamped with a lot of clinical work. And in all this, one has to also find some time to do some publishing. So writing up cases, collaborating with others to produce papers, collaborating with other, international organizations to do collaborative work, publish. And then, one of those things that happens is that all these collaborations and partnerships also then open up, international memberships. So because I'm on the board of the International Society of Pediatric Neurosurgery, and then also on the board of Society for Neuro-Oncology Sub-Saharan Africa, there are board meetings every other week, things to get, apprised with, interviews to do. So it's a very interesting mix of things that one has to do. But our prime aim is to get, on the operating table and impact, do some work that helps with brain and spine diseases. But the truth is that it's only about 10% of our patients who will need surgery. And the other patients have to be managed, have to be followed. And within that 90%, we find, the opportunities to do so many different things that basically push the science of neurosurgery forward. Thank you.
Right, thank you very much. That was very extensive. I think there are a lot of questions in the chat box. We may not be able to get to all of them because of the time, but I'll try as much as possible to merge as many of them as possible. So I think a recurrent question has been an advice you give to medical students and young doctors who are interested in pursuing neurosurgery. I think I'll let Dr. Bando answer that for us.
Hi. So the first thing is to stay focused. It's very easy to be distracted, particularly in your generation. Thankfully, when I was doing my program, Facebook was the thing, Instagram, Snapchat, all those things were not so popular as they are now. It's very easy to lose focus if you're not careful. So the first thing is to stay focused. Now, the next thing is to understand that nothing good comes easy. You should be willing to make sacrifices. It may mean having to sacrifice sleep, having to sacrifice money to get the things like the books you need to study. It may mean sacrificing your finances to buy your own equipment. Sometimes if you want to get things done the way it should be done. So sacrifice is important, if you want to get to where you want to be. And then the third thing probably is to understand that it is not impossible to be a neurosurgeon. There is this, and I think it's a misconception, that it is the super smart people who do neurosurgery and become neurosurgeons. I'm a living example. There's nothing super smart about me. But what I realized is that it takes a lot of hard work. It takes a lot of determination. It takes grit, to get to where you want to be. And I'm certain if you stay focused, you sacrifice, you put in the extra work, it should happen, like you want it to happen. And take inspiration from people like Dr. Totimer, Dr. Idrisu, our godfather in neurosurgery, who has mentored virtually every generation of neurosurgeons that have trained in Ghana and continues to mentor us in the field. Take inspiration from those already in the field. It's a field-proof way of getting there. So that is what I have to say about getting there as a neurosurgeon.
Right. Thank you very much, Dr. Bando. I think I'll like to.
Excuse me. That aspect of the advice that will be given to medical students and also junior doctors who are considering to join the specialty. From my experience and what I've seen, and Dr. Bando has said some very important things that they need to be determined, they need to have interest, they need to be committed, they need to have hardworking. Apart from all that, there's something which I notice, which will encourage them if they really want to be interested in neurosurgery. They should strengthen their basic principle in neurology, basics, basic neuroanatomy. They should understand those basic neuroanatomy. They should also understand the basic neurosurgical examination and neurological examination techniques. Because when they come to the ward, for ward-round teaching, I will encourage that the students must get in touch with the junior resident and the residents. It is true that they will learn a lot. And I also want to encourage the residents and the junior residents to join ward-round teachings and also help the medical students when they come to the ward for the ward-round teaching. That's the only way they can revise their knowledge in the field of neurosciences. They must be involved in teaching the medical students, the basic principles, especially imaging, basic imaging, CT scan, MRI, I mean, the principals, at least they should try to let them be interested. There must be also, must be proactive, investing some of the neurosurgical, we do have seminars and tutorials. They must be interested in it, must be serious, they prepare very well for all those things. Junior doctors must take advantage of these ward rounds, very important, especially the ground ward rounds. And this is what I will suggest to be doing, because they cannot just jump into the profession without having these bases. And most of them, when they come to the ward, they do not show interest in these things. And the junior ones who want to become neurosurgeon, they should be really interested in helping them. And by helping, you will learn a lot through that. That's what
Thank you very much. Thank you very much, Dr. Idris. I think I want Dr. Berrick to answer this last very important question. Most of us want to know the pathway into neurosurgery. Currently, how is it like? If you can take us through the application, what do you have to do to become a neurosurgeon?
Well, I'm not yet a neurosurgeon. I'm still a resident. So, for now, there's a straight program through the Ghana College where you can, after house job, write the primaries and start. I mean, you write the primaries. If you pass, you go through an interview, and then you are selected and posted to an institution to start your program. So for us, our badge is considered the pioneers of the straight program because we are the first batch to start that. So it's still a learning curve. We are still figuring out some things. But basically, after house job, you can write the primaries. Even during house job now, you can apply for the primaries, sit for it, pass, go through your interview. Then after house job, you have the opportunity to start your residency. So it's straightforward. Previously, you had to go and do general surgery for 3 years and then go through neurosurgery. So that's basically it. It's straightforward. Yeah.
How many years is the training?
Yes. So 3 years. The first 3 years are considered. After the 3 years, you'll be a member. Then after the last 3 years, you'll be a fellow. That is the outline of the program.
Okay, this is a personal question. The exam, the preparation, any advice?
Dr. Bando had said that, Dr. Idrisu mentioned, you have to study. The questions are basic, but basic if you learn, and I don't know how to say this, but you just have to learn. You have to go through the neuroanatomy like Dr. Idrisu mentioned, neuroanatomy, neuropathology, neuroembryology, and neuroradiology are usually the 4 main parts that the exam is based on, and is the basis, but obviously you have to learn hard, and yeah, you'll be fine.
You'll be fine. Yeah. Thank you very much. Thank you very much. I think we should end here. I'll invite, we couldn't go through our questions, fine, but I'll invite the education lead. I think I should ask this. Please forgive me. Let me ask this last question. I want to know what the future of neurosurgery is like. I think Dr. Tetime would be, I would like you to answer that question. What do you think the future of neurosurgery will be for some of us who are interested? And then after that, Jonathan can give us the closing remarks.
I think the future is very exciting. Neurosurgery is, if you look at technology, it's the fastest growing in terms of technological complexity over the last 50 years. The kind of neurosurgery that is being done now is very different from what was done 50 years ago. I mean, neurosurgery is much more supported with, technology to make it precise, to make it accurate, to make it, impactful. And, the future is amazing. The technology is growing. artificial intelligence is coming into neurosurgery very strongly. Tumor neurosurgery is growing in amazing ways when it comes to targeting tumors and being able to deal with them. Now neurosurgery has gone to the point where things like aneurysms and arteriovenous malformations are being fixed with catheters through blood vessels using X-rays. Neurosurgery is now into Parkinson's and mood disorders and stimulation of specific targets in the brain. Neurosurgery is pivotal in treatment of epilepsy, and pediatric neurosurgery is even more amazing. I mean, neuroendoscopy is being used to do so much, through minimally invasive access. So in terms of the knowledge around neurosurgery, in terms of the technology around neurosurgery, and in terms of the applications of neurosurgery, there is a big future ahead and very, very interesting times. And I encourage all of you, what you're seeing now is just the tip of the iceberg. There's much, much more to follow. And the thing is that, neurosurgery will hit a plateau in the developed world because they would have done everything that there's to do, and then there will be just small increments. But here in Ghana, this is where the big growth is going to happen. So please stay around so that you can be part of this big explosion of science, big explosion of research and application for neurosurgery. Yeah.
I think also here, a combination of artificial intelligence and robotics technology to drive neurosciences, including the final imaging technologies for reading lesion and tumors, and the use of robotic to direct, complicated, non-invasive surgical procedures that cause no or minimal damage to other tissue in the brain on the central nervous system, and also the cross-sectional R&D in nuclear biology and genetics to unearth some of the etiological causes and etiological causes of etiological causes of lesion in the nervous system must be looked at to improve outcome of prognosis. So that's the future that I think. So one has to also look at that aspect of artificial intelligence. That will be a good future in shaping the journey to neurosurgery. That's what I
Thank you very much. Thank you very much, Dr. Idrisu, Dr. Katime, and all the speakers. And we just wish we had more time. There are lots of things we couldn't get through, but then hopefully, as we continue with our education series, we hope that we could get some of you back to continue some other aspects of neurosurgery. So thank you all. I think I will invite Jonathan at this point to give us some remarks.
Hello, can you?
Yes, we can hear you, Jonathan.
It has been an exciting evening for me, even though my network initially was not good and it came back stronger. So I'm just enjoying the conversation over here. And I want to say a big thank you to all our speakers for sharing their experiences with us. For me in person, I think I've been following quite a number of them. I've been following Dr. Totime on LinkedIn, then Dr. Bando, and I've been reading some of their stories, and it has been exciting. So for all those who are listening or they are on the call, you can check out Dr. Totime on LinkedIn. He writes a lot of beautiful stories that I think he has some books on the Amazon and stuff, and then he's also he does music. You can check him up, and then you enjoy writer. I think almost every weekend I just sit down to read them and read them and read them, and then same for Dr. Bando and Dr. Adrisu. So I want to say this evening has been an exciting one for Incision Ghana, for we having these our great people coming to share with us their experiences in the field of neurosurgery. And I believe a lot of us, we the young ones, have been encouraged and inspired to kind of think about neurosurgery as a specialty to look into, because I think there are just quite a few of them. And then with the future of neurosurgery, it's exciting to see that it's one of the field that almost every day new things are coming up. We have a lot of technology in it because, as Dr. Idrisu said, the brain controls almost everything, and it will be wonderful for all of us to kind of learn more about that organ and then practice it. So I'm most grateful to all our speakers who made it time to join us, and then to all those our audience who also join us. Thank you for joining us this evening, and then we are looking forward to having another education series. So we mainly we do it at least every 2 months. So we are hoping by December we have another one. And I must say, I'm very, very happy this evening. So I've heard from some of our legends from the neurosurgery field in the country. So I want to say a very big thank you to our speakers once again. Thank you all.
Right, and thank you for having us.
Dr. Lucas, I don't know if you can
Yeah, I think
picture.
it's been a very wonderful session. I'm actually, my mind is exploding about how the future will be. And we are most grateful to all of you for being here and staying online till the end. And we are really sorry for going past expected time, because the conversation was so nice. So please have a lovely evening, everyone.
Oh, I wanted just to take a picture. I don't know if that will be possible still.
Yeah,
Thank you.
people are ready to turn on their videos.
Yeah, please just put a video
Yeah.
for a short time. I don't know how do I take a screenshot, or there's a way to take the picture? I'm not
Yes,
sure
you
how.
can take a screenshot, just a screenshot.
Dr. Ted, Dr. Douglas, if you can do that, I'm not sure how to do that. Okay.
Yeah, second one. He's as ready as can be.
Okay, so we are waiting for it to
I
on your
think I'm
camera.
done.
You are done.
Yeah. Yeah.
Okay. All right. Thank you all for joining us. Have a lovely evening.